Hi, my name is Dr. Joshua Light. I'm an ear, nose, and throat physician, and I specialize in otology, which includes diseases of the ear, both medical and surgical. I'd like to describe to you a very common form of dizziness that we see frequently here in the office. It's called benign positional vertigo. First, I'll explain what the symptoms feel like, then I'll go over what causes this condition, and from there I'll be able to explain to you how we're able to treat it. Patients with benign positional vertigo will describe actually seeing the room spin. It doesn't happen all the time, however. It occurs when it is provoked by certain changes in head position. These changes in head position include when a person will first lie down in bed and turn over to the side, and also when they go from a lying down position to a sitting up position, especially first thing in the morning. The length of time that a person will describe feeling the actual spinning when they see the room spin usually is in the order of 10, 15, or 20 seconds. A person may describe feeling lightheaded, dizzy, and woozy for a much longer period of time. But when we're very specific in talking about seeing the room spin, the duration of time is actually quite small. It will occur again, though, with each change in head position from vertical to horizontal or horizontal to vertical. Some patients have been experiencing this symptom for years, and many doctors, while they understand what the underlying problem is, don't recognize that there is a simple, straightforward way of curing this condition. In order to understand how we treat the condition, first I'm going to explain what causes it. Within the inner ear, there are the semicircular canals and an area called the vestibule. Within the vestibule, there is an organ which is responsible for feeling gravity. It tells us where the floor is and which direction up is in. And the way that we feel this is actually the weight of very tiny crystal debris which sits in the vestibule. For reasons that we don't fully understand, these crystals, these particles, can break free and start floating around within the inner ear fluid. When these crystals float into the semicircular canals, they begin to cause the problem of benign positional vertigo. Based on the orientation of the semicircular canals, the crystals will not always move with every change in head position. The way that I compare it and describe it is that it is similar to a paperweight snow globe. People are familiar with the paperweights that have those little white particles in them. When you turn them upside down, the particles will shift from one side to the other. That's what's occurring in benign positional vertigo. Just like with the paperweight, if you simply slid it from one side to the other, the particles wouldn't move. It has to be changed in its orientation in a very specific way. So too with the ear. These little particles that are free-floating within the ear, when you turn your head in just the right way, shift. When they shift, they stir up the inner ear fluid, and this is what produces that sensation of spinning. When a patient comes in with this condition, there is a very specific technique that I am able to do that will diagnose it and also tell me which ear it is occurring in. The reason that it's important for me to know which ear it is in is for the treatment. The way that we treat this condition, which is probably what you want to hear, is something called the Epley maneuver. In this technique, simply by rolling a person around in a series of different positions, we can actually get those crystals repositioned out of the semicircular canal. In this simple, quick, painless technique, we are able to abruptly stop the vertigo completely. Although this may sound like voodoo, by understanding the underlying physiology, you can understand how this technique is scientific and effective. We see hundreds and hundreds of patients with this condition every year. And I'm happy to tell you that we have greater than a 90% success rate in eliminating this vertigo with the Epley maneuver. If you are experiencing symptoms of dizziness, whether they are benign positional vertigo or another form of dizziness, please do not hesitate to call our office. Our phone number is 561-737-8584. Thank you.